guys, this is Lily and welcome to my YouTube channel. In this video, I'm going to share with you a script that can be used in the massage therapy, oral or practical examination, either in your school or in getting your license to become a registered massage therapist or an RMT. So this script is for the room 1, which is the remedial exercise, and I'm gonna share this script with you so you will be able to use it. This script is the script that I used during my massage therapy or a practical examination, but you have an option to just change something on the script or use it. It's really up to you. Okay, so this is only a script to help you in your examination. Now, in room 1, which is the remedial exercise, okay, so in the real scenario, you're gonna be opening the door. So upon getting inside the room, this is what you're gonna say. So you're gonna say, hello everyone, good morning or afternoon, whatever daytime you are in for the examination. Okay, so this greeting will be addressed to all. Okay, so to your client and the CMTO examiners as well. So then when you get into the room, you should show your sweet smile right away. Okay, show them that you are happy that you're there. Okay, and then you proceed right away to the examiners, which you can be seeing just at the corner, okay, on the side of the room, and then you get your name scanned. Okay, so you should be showing them a sweet smile. Okay, it's very important. Now after that, you're gonna proceed to sanitize your hands and your elbows. Okay, so you're just gonna do this very quickly because you only have 10 minutes to do each exercise, so to do each examination in each room. Okay, so very quick, you say your words very quickly. Okay, so you're just gonna say, once you are sanitizing, I'm gonna just wash or sanitize my hands and elbows for like 10 seconds. Okay, and then you proceed to face your client. Okay, so you're gonna say, hello there, I'm your name, state your name, your therapist for today, and then you're gonna say, how are you? Okay, so this is your introduction right after you face your client. How are you? And then you're gonna, after saying how are you, if the client will respond, I'm okay, I'm good, and then ask you how are you, then you're just gonna answer as well. Okay, then right away, before you start with your script, you're gonna ask the client right away, are you comfortable in your sitting position right now? If the client is seated, then that's what you're gonna say right away. Okay, this is client care. Most of the time, this is what the examiners are looking for. Okay, client care. So once you say, are you comfortable in your sitting position right now? And if the client says yes, then you have to proceed with your script, with your introduction. Okay, so you're gonna say, we have now finished our treatment, and today I would like to teach you some stretching and strengthening exercises for you to do at home. You see, I stated here we just finished our treatment, okay, because in the scenario of the practical exam, they just do it step by step, room by room, for the examiner to see that you are capable and you're ready to become a registered massage therapist. Now you're gonna be, putting in your mind that during the practical examination, you are doing the real treatment to a client. Okay, just like you do a treatment for like an hour in one treatment, on one appointment for a client. Now, the scenario of the remedial exercise in a real treatment, it is always, taught to a client after you did everything. So after you do your treatment, now you're gonna tell them your remedial exercises, okay, for them to do at home. So that's why in the beginning of my script it says we have now finished our treatment and today. So you assume you finished your treatment already with the client, and now you're teaching your client remedial exercises, okay? So that's why the introduction is, the statement is like this, okay? Now, after saying this first statement, then you're gonna explain why you're teaching the exercises, the stretching and strengthening exercises. What are the purposes of teaching them these exercises for them to do at home? So you're gonna say the stretching exercises will help you stretch your tight muscles, and the strengthening exercises will help you regain your muscle strength. Okay, it's very important so that the examiners will know that, the purpose of you teaching your clients all these exercises. Now, next you're gonna say, before doing these exercises at home, please take a warm shower or do a light cardio exercise like jumping jacks or going up and down the staircase for like 5 to 10 minutes to warm up your body and to prevent injury to your muscles. Okay, so here in this statement, it's very important to show the examiners that, you are trying to tell the client to do this warm-up exercises and showering in order to prevent injury to their muscles. Okay, so and then you're gonna say, please drink lots of water during the exercises to maintain hydration. It's very important as well. Okay, the exercises should be pain-free, and if you feel any pain and discomfort, please stop immediately and come back to see me in the clinic. Okay, so it's very important as well to say this statement so that the examiner will know that when the client feels pain while doing the exercises, the client should stop immediately and then will come back to see you, the therapist, in the clinic. Okay, so then you're gonna say before you start the exercise, so I will first show you how to perform each exercise. Then I will ask you to repeat the exercise for me so that I can ensure that you will be able to do the exercises at home properly and safely. So this statement is very important as well before you show the client, before you proceed on, or before you begin with your exercises. Okay, and then you're gonna say, for your safety, I will stand beside you at all times to support you. So while the client is doing the exercise, after you show him or her the exercise, then you have to stand beside the client and show that you're ready to support the client. It is important as well for the examiner to see. Now, you will finish your introduction by, do you understand everything? Okay, you wait for the client to answer, and then, do you have any questions before I begin? Then you wait for the client to answer as well. Okay, so in your practice, you're gonna, be practicing all this, before, when you're getting ready for your practical examination. Okay, so I'm just gonna show you the script for all these, for the room 1 remedial exercises. What are you going to say while you teach the client the exercises that you're gonna perform? So in the real practical examination, you will be given 4 kinds of remedial exercises. So either they're going to give you isotonic exercise or exercises, isometric exercise or exercises, or static stretch or stretching exercises, or hold relax or contract relax exercises. Take note, guys, you'll only be given 4 different kinds of exercises for you to perform to your client inside the room within 10 minutes. Okay, so your script, your introduction is already included in your 10 minutes, so you should be able to say it very quickly. Okay, like in 1 minute or 1.5, so very quickly. And your performance as well should be very quick. Okay, but take note, you should be showing client care, be gentle, okay, and show every time client care to the client. Okay, it's very important. That's what the examiner is looking for during examination, practical examination. Okay, so moving on, the script for the exercises. So you're gonna choose, outside. In the scenario, you will decide while you are outside. You're given 2 minutes to decide, to study the scenario, to decide, and to practice outside before you go into the room. So you have 2 minutes. So you decide for yourself which exercise you want to do first, and which exercise you're gonna do the second, the third, and the last. Okay, so for the first exercise, before you do it, you're gonna say, the first exercise I'm gonna teach you is, okay? So like I said, this part will depend on which exercise you, the student or the examiner, wishes to do according to his or her preference and confidence, okay? So there's no specific order in performing the exercises, okay? So if you decide on, say, performing isotonic exercise, then the script for this is, you're gonna ask the client first to stand, okay, and then once the client, this script is taught to client, or is you're gonna say this script. Okay, so while performing or showing the exercise to the client, you're gonna say this script. Okay, so you're gonna stand, and then you're gonna say, please maintain good posture and normal breathing while doing the exercises. So you're showing your client as you perform. Okay, isotonic exercise, or isotonic, means strengthening the muscle against a moving resistance using a TheraBand or a dumbbell. Okay, so you're gonna say this while you are showing your client, teaching your client how to perform the exercise. This is your introduction, your script. The muscle is located here, so whatever is in the scenario, which muscle, then you have to point to the location of the muscle without touching the area. It's very important not to touch your body, because of, you already have sanitized your hands. Okay, so make sure you're not touching your body, because you're gonna touch your client while performing the exercise. Okay, so if for example, the muscle being asked in the scenario for to perform for a isotonic exercise is the deltoid muscle, then you're gonna say, the muscle is located here, which is the deltoid, and it does the action. So you're gonna show the action of the deltoid muscle. Okay, that's very important. And then this exercise should be pain-free. If you feel any pain or discomfort, please stop immediately. So you're telling your client while teaching him or her the exercise. So perform the exercise as after saying this introduction. Then make sure the client has a good posture during the exercise and is breathing normally. Okay, so when you're done your introduction, you you do your introduction, you do your exercise you perform in front of the client, and then you're gonna ask the client to stand up and then perform the exercise. So you're gonna say, when you're done doing the exercise, you're gonna say, can you do this exercise for me? And then the client will say yes, and then, okay, can you please stand up? Now when the client is standing up, you're just gonna, the first thing you're gonna say is, are you comfortable? Are you comfortable in your standing position right now? Yes. And the client say yes, good. And then they're gonna say, please maintain good posture and normal breathing while you're doing the exercise. Okay, those are the most important points that you need to say. Now the client will start showing you the exercise. You need to stand beside the client to make sure you are there to support the client. That's client care. And then you're just, watching the client. And then if the client is not doing the exercise properly, then you have to correct it, okay, while the client is doing the exercise, okay. And yes, that's it, okay. And then once the client is done, you need to ask the client to sit down first before you proceed, okay. Okay, so once the client has finished performing the exercises in front of you, you're gonna ask the client to have a seat, and then you're gonna ask the client if the client is comfortable right away. And then once the client said he or she is comfortable, then you need to tell the client, okay, so at home, please perform the exercise for 10 repetitions for 3 sets. Okay, so 1 set, 10 repetitions, do it for 3 sets, and in between repetitions, you need to relax for like 30 seconds or 1 minute. Just say 1 minute, and then do it once a day, okay, for at least 3 to 4 times a week. Okay, so this is, you're gonna say this to your client after each type of exercise, okay. Now once you're done with the first exercise, so if your second exercise is isometric exercise, you're just gonna say, now the second exercise I'm gonna teach you is the isometric exercise. Okay, so again, you're gonna perform in front of the client. You're gonna stand, and you're gonna maintain good posture. So you're gonna say, please maintain good posture in normal breathing while doing the exercises. This is, you're saying this in front of the client while you start to perform, to show the client the exercise. So you're gonna describe, okay, so you're gonna say isometric means strengthening the muscle against a static resistance using a wall, a towel, and your body. Okay, so holding the contraction for 5 seconds. Okay, the muscle is located here, so you're gonna show the muscle, the location of the muscle according to your script, okay. And so again, without touching the area, and the muscle does this action, okay. You're gonna show the client the action of the muscle. Now this exercise should be pain-free. If you feel any pain or discomfort, please stop immediately. So this is a statement that you're gonna just say to the client directly, okay. Then perform the exercise after, to show the client how to perform the exercise. Make sure the client has a good posture during the exercise and is breathing normally, okay. So once again, the client is sitting while you show the client, perform the exercise. Okay, once you're done, you're gonna ask the client, can you do this exercise for me? When the client says yes, then you're gonna ask the client, please stand. Okay, once the client stands, then you're gonna ask the client, are you comfortable in your standing position? Then when the client says yes, then that's when you ask the client to start the exercise. And then you're gonna ask the client to, and you're gonna say to the client, please stand and maintain good posture and maintain normal breathing while doing the exercises. Okay, so the client will start showing the exercise as the client, according to what you showed to the client. Okay, you stand beside the client to support the client. And if the exercise is not, if the client is not performing the exercise correctly, then you're gently gonna correct the client to do the proper exercise. Okay, and then once the client is done, then you're gonna ask the client to take a seat, and then ask the client right away if she or he is comfortable in her or his sitting position. Is always client care. And then once the client is comfortable, then you're gonna say, okay, please perform this exercise at home. Hold the contraction for 5 seconds. Okay, you do this for like 6 to 10 repetitions. You do this exercise for 3 sets. In between set, you can relax. You should relax for 30 seconds or 1 minute. Okay, and then do this exercise for 3 to 4 times a week. Okay, so guys, you can modify this script. It's just to show you some ideas. Okay, all right. The next exercise, so if you're gonna do this static stretch as your third, so you're gonna say the next exercise I'm gonna teach you is the static stretch exercise. Okay, so again, you're gonna be standing in front of the client. Okay, so to perform this exercise, you're gonna say, please maintain good posture. You show the client a normal breathing while doing the exercises. So you show the client, or you teach the client the static stretch. Okay, and then you're gonna say static stretch. So you define first, okay, before you perform. Static stretch means stretching the muscle from the origin to the insertion with controlled movements, holding the stretch for 30 seconds. Okay, so please avoid any bouncing movement during stretching since it can injure the muscle. Now you're gonna say, now I'm gonna perform, or I would like to perform a therapeutic stretch on you, or a static stretch on you. So you're gonna say, I will be working on your which muscle. Okay, so if it's deltoid, then you're gonna say deltoid muscle, and then you're gonna locate the muscle without touching the area, and you're gonna show the client the action of the muscle. These are very important. Okay, these are points in the exam. So you perform the exercise, make sure the client has a good posture during the exercise and is breathing normally. Okay, so you're gonna show the client this. Now, once you're done performing or teaching the client the exercise, you're gonna ask the client if the client can you, so this is what you're gonna do. You're gonna ask after, can you do this exercise for me? So when the client says yes, then you're gonna ask the client to, stand up if it's standing up, or if it's sitting down position, or whatever, whatever the exercise that you want, the position of the exercise you want your client to do. Okay, so it's the same thing again. If it's standing position, you can ask the client care right away before the client does anything. Okay, are you comfortable in your standing position? If it's standing position, if it's sitting position, are you comfortable in your sitting position? If it's lying down position, are you comfortable in your position right now? When the client says yes, then that's when you continue. Okay, so you're gonna say, please maintain good posture and normal breathing while doing the exercise. So you're gonna check on that with the client. Okay, and then the client, okay, so the client starts to perform. Okay, please do the exercise for me. You're gonna say that. Client starts to perform the way you show the client how to do the exercise. Like I said, while the client starts to perform, you're gonna stand beside the client, trying to protect the client. And if you're checking on the client, if the client is doing the exercise properly, and if there's correction, you correct the client. Okay, so so you continue that, and then when the client is done, you're gonna ask the client to take a seat, and then ask the client if the client is comfortable in his or her sitting position. This is client care right away. And then you're gonna tell the client, okay, so please perform the exercise. Hold each stretch for at least 30 seconds. Breathing in while you stretch, breathing in and out while you stretch. And then there's 30 seconds, or after 30 seconds of stretch, then you're gonna tell the client to relax 1 minute, 30 seconds or 1 minute in between this stretch. And then you're gonna tell the client to repeat this stretching exercise for 3 sets. and the client should do this once a day, okay, every day. All right, so it's very important. This is the instruction you need to tell the client. So all of this, okay. Now, like I said, there are only 4 types of exercises that the practical exam would ask you to do. But in this video, I'm gonna teach you, or I'm gonna give you the script for the hold, relax, and contract relax exercise as well. Okay, if you are given the hold, relax exercise, then this is the script you're gonna say during your examination. Okay, so again, you know what to do. So you're gonna say, please maintain good posture and normal breathing while doing the exercises. Okay, so first you're gonna show the client how to perform the exercise. Okay, and this kind of exercise, the hold, relax, and contract relax, you perform this exercise to the client right away, directly to the client. Okay, and you're gonna describe the exercise first, like like the usual. Okay, so hold, relax is a stretching technique, and during this technique, this is what you're gonna tell the client. Okay, before you perform, I will ask you to contract your muscles, and you hold the contraction for 6 to 10 seconds. Okay, and if you feel any pain or discomfort, please let me know and I will stop immediately. Okay, so before you do the exercise, this is what you're gonna say. This is your script. Now you perform the exercise. Okay, so usually if you are touching the client, you ask the client, can I touch you? Can I touch you here? Then the client say yes. It's only client care. Okay, if you can do that, then that's perfect. Okay, so then you perform the exercise, you show the client. So this exercise so it's very important to tell the client for the hold, relax, and the contract relax exercise if you happen to get this on your examination. Okay, so you show them, but you will say this exercise is only performed here in the clinic, and you cannot do this exercise at home. Okay, because it is not safe to do this exercise at home. So you need a therapist to help you do this exercise. So it's only done in the clinic. Okay, so this exercise cannot be done at home. It can only be done here in the clinic. Okay, so take note of that. Right, so you perform the exercise, and then once you're done, then you're gonna ask the client to that's when you're gonna tell the client, when you're done, then you're gonna ask the client to take a seat. If the client after the exercise, to take a seat, because this exercise is performed by you with the client directly. So take a seat, and then ask the client again if the client is comfortable. Okay, and then that's when you tell the client, okay, so this exercise cannot be performed at home. It can only be performed here in the clinic. Okay, so that's what you say to the client. Now, same thing with contract relax. Okay, so same script. So the next exercise I'm gonna teach you is contract relax. So you're gonna define contract relax. Contract relax is a stretching technique. During this technique, I will first stretch the muscle, then I will ask you to contract your muscles against my resistance, and I will allow the muscle to slowly contract for 6 seconds. Okay, so you're explaining first before you do the exercise. And if you feel any pain or discomfort, please let me know and I will stop immediately. So you're going to tell your client that you will be performing the exercise directly on the client. And then once you start, you're going to ask permission, can I touch you in this area? And then if the client said yes, then you continue with the exercise. Okay, so perform the exercise gently. Okay, and then once you're done, you ask the client to take a seat. Okay, and once the client is comfortable, you ask the client as well, are you comfortable right? Are you comfortable, or are you comfortable in your sitting position right now? Okay, when the client said yes, then you're gonna say it's just quickly because you have only 10 minutes. Okay, please do not do this exercise at home. This exercise can only be done in the clinic. Okay, good. Okay, so once you're done with your exercise, you're gonna end the examination by saying, okay, we're done with our exercises for today. Thank you for your time, and I will see you again in how many weeks or days. Because take note, guys, in your scenario at the very bottom, there is always the statement that's saying, see you again in how many weeks, in 1 week, 2 weeks. It is there, very careful. It's down at the very bottom of the exam scenario, there is a comeback, appointment. So you need to say that after you're done with all your exercises. If you have time, then you really have to say that. That's another point. Okay, so here you go. I hope I will be able to help you in your practical or examinations for massage therapy, either in school or for your licensing, the CMTO licensing exam. Pretty much these are the same. You can create your own based on this script. Okay, there's no right and wrong, but make sure you include all the points, those important items that the examiners will be looking to give you more points. Okay, so this will be done very quickly, so I advise you guys to memorize your script and practice more so that you will be able to do this test within 10 minutes of the time. Okay, so I'm gonna finish my video here. Thank you all for watching my video. Okay, so please like, comment, share, and subscribe my channel. Have a great day.